Welcome to another edition of Top Child Surgery to Merita, and especially welcome to another episode of our Disability Awareness Series. My name is Merit, and I'm a pediatrician. Today, I'm going to be discussing one of the most commonest causes of physical disabilities in children. A lot of people would have seen children with cerebral palsy. Sadly, they may have stood, stared, make gestures at them, or even cuss at them. I believe that after today's teaching, we'll understand what cerebral palsy is and how best to support people with cerebral palsy. First of all, what is cerebral palsy? Cerebral palsy is a condition that affects a child's ability to move, to have good balance either when they're seated or standing, or to ability to coordinate their muscles. And this occurs as a result of damage to a developing brain. It is very important for you to understand that cerebral palsy is not a spiritual problem, it's not a mental condition, and it is not contagious. Most children with cerebral palsy have normal intelligence, just a few of them may have one learning disability or the other. And there are different causes of cerebral palsy. The commonest cause is babies who are unable to take in their first breath or cry as soon as they are born. Now, when a baby is born, they let out a cry or take a good breath. That first breath changes the dynamics in the body. It helps the heart to function better. It helps the lung to function. It helps the brain to function. It helps all the organs and tissues in the body to function. And if a child doesn't take this breath, it can cause damage to their brain. Another cause is prematurity. Prematurity, preterm, babies who are born before 37 completed gestational age, 37 weeks completed gestational age. The younger the babies at birth, the higher risk of them developing cerebral palsy. Another important cause is jaundice. A lot of people underestimate jaundice a lot. They take advice from family members, neighbors, and friends and put their children outside under sunlight to help reduce their jaundice. One thing you must understand is that if the jaundice level is high and it crosses to the brain, it can cause damage to the brain and cause cerebral palsy. Another important cause is infection. If your child is unwell, please take your child to the hospital for assessment because this infection can cross to the brain and cause brain damage. Another cause is stroke. Just the way we see strokes in adults, we can also see strokes in children. Okay, so how do you prevent cerebral palsy? So I'm going to take it from all the causes I have listed. If you're pregnant, you need to register in a hospital, in a good hospital for your antenatal. Make sure you take your antenatal seriously. If your doctors advise that you need cesarean section, please don't decline. That is not the time to start defining who you are. I'm a Hebrew woman. My mom delivered via the vagina. I must deliver. Even my sister, I go to church. Don't get me wrong, it's good to have faith. But please, consider your unborn child. And don't go to traditional birth attendants. Don't deliver at home. Go to a good hospital and deliver your baby. And if you are in labor and it's going to be a preterm, please go to a hospital that have good newborn care just to avoid damage to your child's brain. And if your baby has got jaundice, don't put them under the sun. Take them to the hospital to have a test to see if it is necessary to start treatment or not. And if your child has got infection, don't treat yourself. Don't go to over the counter to get your child treated. Now, how do babies with cerebral palsy present? Now, if you have a baby at 6 weeks to 2 months, your baby's neck is not stable. They are seated and their head keeps falling, their neck keeps falling. Or you have a baby at 6 months to about 9 months, they are still unable to sit. Or a baby from at 9 months to 12 months, they are unable to hold something to stand or cruise about. Or a baby at 12 months to 18 months not yet walking. You have to suspect cerebral palsy. Take the child for assessment and start care. Sometimes people with cerebral palsy may have problems with their legs. Their legs are so stiff that they can't move, or they have problems with their hands. They can't move their hands, or their hands are not functioning well, or they have problems with swallowing. So they can actually present like that. And how do you help a child with cerebral palsy? If your child has got cerebral palsy, please love that child. Accept that child, support that child. Make sure you take them for regular checkup. Enroll them with physiotherapy, occupational therapy, speech therapy, good school that can support them. Some will need walking aids, some will need push chairs, some will need one support or the other. Please don't keep them away from the public. Don't hide them in the room. Don't hide them in the house. Let them mix up. They are children. They are important. Please don't compare them with the rest of your children. Please. And you listening to me, you don't have a child with cerebral palsy, you don't have any family member with cerebral palsy. Please, if you see a child with cerebral palsy, don't gesticulate, don't insult them, don't make fun of them, love them, support them, give them a helping hand. Parents, teach your children to support children with disability. They shouldn't bully them, they shouldn't laugh at them. Please. They need help with standing up, help them. They need help with being pushed around, please help them. And I believe that as we do this, we'll make our society a better place. And most times, put yourself in the shoes of people with cerebral palsy or with families that have got children with cerebral palsy. When you do that, you will realize that they deserve love, because you know that if you're in that shoes, you will want someone to love and care for you. So I believe with that heart, you also give the same amount of love to families, to children with cerebral palsy. Once again, thank you for listening. I hope you enjoyed this teaching. Please like, share, follow my page, invite your friends to follow my page as we continue the series. Thank you for listening and have a nice day. Bye.